Hi, my name is Jerry Hickey. I'm a pharmacist, I'm a nutritionist, I'm the Chief Scientific Officer over here at Untitled Health. We're here today to talk about a wonderful B complex vitamin called vitamin B12. Now, B12 is really important. It has many different functions. B12 is important for your brain. It actually is involved with the architecture and function of the brain. It protects the brain in aging. B12 is needed for nerve health and nerve comfort. B12 is needed for the formation of your red blood cells. Without B12, you don't have healthy blood cells. B12 is needed for energy, and it can help with fatigue. If you lack B12, you could feel quite tired. And B12 is absolutely needed for eye health with aging. B12 is considered a water-soluble vitamin. Some is stored in the liver, but generally you need some every day. And there's a lot of people that could use a little bit more B12. They can actually use a B12 supplement. So I'm going to review that for you right now. And I'm going to read from this paper so I don't skip anybody, because this is such an important supplement and such an affordable supplement. So who needs B12? Aging people. The lining of the intestines gets a little thicker. You're releasing less digestive juices. So it seems to be a little bit harder for older people to use and to metabolize and to use. So it's not just absorption that suffers with age to a degree, it's also the utilization of B12. So giving a little bit extra B12 once in a while is a smart move for most older people. And don't forget, it is brain health enhancing. Now, vegetarians don't get a source of B12 that's very soluble and absorbable and usable. So vegetarians should supplement with B12 at least a few times a week. HIV patients, they need additional B12 for nerve health and for energy. People with digestive disorders commonly cannot absorb vitamin B12. This would include people with Crohn's disease and colitis. They have trouble absorbing many vitamins and minerals and other nutrients. People on ulcer treating medication. The ulcer treating medications decrease the release of hydrochloric acid and digestive juices, and these people have trouble absorbing vitamin B12. So these are ulcer treating medications. Now the same goes for people with Helicobacter pylori infections. Helicobacter pylori is a common infection that causes ulcers and other problems with your stomach and small intestine. And people with Helicobacter pylori infections, they can't release a certain factor from their stomach cells. It's called intrinsic factor that's needed to absorb B12. So people with that particular infection need a B12 supplementation. Diabetics on the drug metformin. So many diabetics are successfully using the drug metformin to protect them. Well, metformin increases the need for additional B12 and more than likely folic acid, also a related B complex vitamin. People with bariatric surgery. Bariatric surgery, there's different forms. These are people who are morbidly obese. They're generally at least 100 pounds overweight, and it can hurt their health and their ability to function. So they go for different surgeries to help them lose weight, and the problem is these surgeries complicate the absorption of valuable nutrients, many nutrients needed for brain health, many nutrients needed for nerve health, many minerals needed to build bone. But one of the nutrients that's poorly absorbed by people after bariatric surgery is B12, so giving them a little bit of extra supplementation seems to be the wise thing to do. People with eating disorders, they generally lack every nutrient. And also, in general, anybody who's taking a laxative or diuretic may need a little bit more B12. B12, energy, endurance, it's good for your brain, it's good for your nerves, it's good for your eyes. You need it to create red blood cells. It's a good thing to have.